All right, so I'm going to do a mock check off on how you all need to do to put the NG tube down. So you're gonna have your doctor's orders, you're gonna have your cup of ice for your patient or water for them to drink. You need tape, clean gloves, you need your Salem stomp, your stethoscope so you can be able to listen for placement. And since you all don't have a piston, go ahead and use a 10 cc syringe in order to do your air to verify placement, all right? So the first thing you wanna do is verify your orders. So I have Miss Pumpkin Eater, she's here. The doctor wants me to put in an NG tube for decompression because she's been having some nausea and vomiting, so therefore she's NPO. So I'm going to gather all my supplies, which I have here, and I'm going to do my hand hygiene, do my white caps, and explain the procedure to my patient. Good morning.
Good morning.
My name is Alicia. I'm going to be your nurse on today. Can you verify your name and your date of birth?
Ashley Wicker, 3894.
Okay, so I'm going to put your arm down. Okay. All right, Ms. Booker, I understand that you've been having some nausea and vomiting, and the doctor wants me to put down an NG tube. Have you ever had an NG tube before?
No, ma'am.
Okay, so what we're going to do, have you had any nasal injuries or any kind of nasal surgery, anything like that before?
No, ma'am.
Okay, so what we're going to do, I'm going to put a tube down. First, I'm going to verify that it's patent in your nose. Just try to make sure there's no blockage anywhere. And then I'll decide which one is your better side in order to put the NG tube down. It is very uncomfortable, but I promise you I'm going to walk you through the procedure to make sure that you're okay. If I feel like that you're in some type of distress, I'll wait a few minutes and give you time to gather yourself, and then we'll proceed on. Once we put it in, then the doctor wants me to verify placement by x-ray. That's what I want to make sure that it's not in the lungs and it's definitely in the stomach. And then once we get that verification, then we will hook you up to suction, okay? All right, most patients also want ice chips when we hook them up to suction. It's defeating the purpose, but we will give you something to keep your mouth kind of wet because your mouth will dry out, okay? You have any issues, any questions? Do you have any cultural religious beliefs that will hinder me from taking care of you on today?
No.
Is it okay that I touch you?
Yes.
Okay, all right, so I'm gonna gather my supplies. So I'm verifying my order and she's giving me permission to do it. First thing I'm gonna do with my gloves on. All right, Ms. Booker, if you do not mind, can you hold your back of your head for me? Okay. All right, and with each side, I want you to sniff in for me and do the opposite side. Okay, so this side is more patent because I hear better airflow, so I'll put it on this side, all right? Are you right-handed or you left-handed?
Right-handed.
Okay, so you're right-handed, so that'll work out perfect for you because it's gonna go on your left side, okay? All right. So I verified the side I'm gonna do it on, and that's very important. So I'm gonna open up my Salem slump. And this is a clean procedure. So I am going to open this up and make sure that it does not flop anywhere. You want everything up front because remember this is going down in the body. First I need to do my measurements. After I do my measurements, then I'm going to drape her with towel just in case she gets nauseated, all right? So, oh, we're going on this side, I'm sorry. This is our side. So I'm gonna go from the bridge of her nose, the tip of her nose, behind her ear. And do this. Behind the ear, down to the xiphoid process, which should be about right in here, all right? So as you can see, she's at 57, so 55, 56, 57. And I normally go down like another 2 inches, and that's for me to verify to make sure that it's in there. So I'm going to put my tape at 59, all right? So I have my placement here. So this is gonna be how you know where it's supposed to be. And this also helps you when the patient maneuvers or move and you're checking to see if it's where your marking is. If it's out, then we know that if the patient's getting any kind of feed or anything like that, that they're not getting what they need because it's been moved. Like I said, I'm gonna do 59. Okay. All right, and I also have my lubricant here because I want to make sure that it's lubed because you don't want to put it down dry. So I put my lubricant on it. All right, Ms. Ricker, I'm gonna give you this cup. So what we're gonna do, once I start to advance, you're probably gonna feel it in the back of your throat, and I'm gonna ask you to open your mouth to make sure that it is going past the uvula. And if I don't see it, if I see where it's not coiling in your mouth, because that's the main thing, you don't want it coiling in your mouth. If it's not coiling, then I will have to have you to tilt your head all the way down. And as I'm advancing, I will tell you to swallow, so you'll just take some sips of water until we get it down, okay? If, like I said, if you start feeling any kind of distress, I will stop and give you a minute to relax, okay? All right, so I'll give that to you. All right, so once again, you're gonna just recheck again to make sure that everything is where you want it to be. And like I said, she was here, but I dropped down to make sure it's definitely in there. All right, okay, are you ready? All right, so we're gonna go in. Okay, I'm gonna let you open your mouth for me, because at this point, we should be here. And I'm gonna look in, and I don't see where it's coiling. All right, so now I'm gonna let you tilt your head all the way down to your chest, and then I'm going to let you start taking those sips of water, and I'm gonna tell you when to go. All right, swallow, 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 and swallow. Okay, so at this point, I am where I need to be, which is here. So I'm gonna have my other piece of tape, and I'm going to tape it to the bridge of the nose to hold it in place. Okay. All right, next I have my piston, and I have my stethoscope. And we know that the stomach is on this side, because this is where it needs to be. So I'm gonna place here. I have my piston. I'm gonna draw up 10 cc's of air. I'm gonna unhook here. Do not throw that away. So you're gonna add that there. And you're gonna put this here. I have my stethoscope over the stomach area. And I'm going to, and you should hear a whoosh. If you hear a whooshing sound, then you know that you're definitely in there. But we do verify with placement. Now, sometimes if the patient is very distended and they have a lot of gastric secretion, that's the whole purpose of the towel, to drape, you will know definitely that you're in place, because as you're advancing, then the fluid, whatever's in the gut, is gonna start coming out. You still need to get verified placement by x-ray, because it's very, very important, because sometimes the patients start moving around, it can maneuver and come out of place. All right, so Ms. Wicker, are you feeling okay?
Yes, ma'am.
All right, I know it's a little bit uncomfortable, so I verified that it is in place. So I'm gonna go ahead and I'm going to secure it with some more tape. In whatever facility that you work at, they do have the nose bridge for NG tubes. If I can get this tape off. So here, because I want to look at, I'm going to split it in half into 2 pieces. The wider piece goes here. The other piece goes there, because I'm looping it around. And then I will get a safety pin and I will tape it here. But I'm gonna put a piece of tape here till I go get a safety pin. And this is also to keep everything in place so it does not move. And then we'll wait on x-ray for placement. And that's the end of your mock checkup.